Health Minister Zweli Mkhize is promising 1.1 million South Africans will be vaccinated against COVID-19 by the end of March. But the second phase of the vaccine rollout could take up to 6 months. Mkhize briefed the National Council of Provinces on the country's vaccine rollout strategy today. Bary Bateman following this one for us. He joins us now live. So, Bary, we've heard time and time again about the issue of global supply and demand of these vaccines. What does it mean for South Africa?
Yeah, good afternoon, Shahan. Well, Minister Zweli Mkhize going into some detail there about how South Africa has got several, I suppose you can call them streams open to negotiate with various organizations and companies around the world to secure those doses of vaccines. Now, some of them have already been secured and the talks are in the final stages, but he also referred to other aspects or countries that are in talks with South Africa. For example, the Sputnik vaccine from Russia that is also being looked at as a possible product to be used here. So those talks are underway. But he also spoke about the significant role that's being played locally in preparing, putting in the groundwork to be able to roll out the vaccines. Of course, we know about stage one, or phase one rather, which is the healthcare workers. They're the frontline workers who have started getting their jabs since that first consignment of 80,000 doses of Johnson & Johnson product arrived a week or so ago. But he had this to say about what's going to be happening in the next few months before those jabs get to you and I, Shahan.
We have started our program. As we speak now, we have already vaccinated more than 32,000 health workers, and we have received the first 80,000 of the doses. We have said that, excuse me, we have said that in the next few weeks we'll actually be receiving 500,000 doses, and those doses will cover some of the health workers, and in the process we'll also receive this from Johnson & Johnson. In the process we'll receive another 600,000 that will come from Pfizer, and so it will be able to get over 1.1 million people vaccinated between now and hopefully the end of March. That process is going to ensure that all the health workers either get the once-off dose or the first dose, which means we'll have about 2 to 3 months to be able to give them a booster dose. Thereafter, we are hoping to get vaccines. Most of the supplies will start showing in larger numbers from April, May, June, and then, of course, more supplies.
Yeah, that sounds far away, doesn't it, especially when people are dying daily. So the logistics of this vaccine rollout also coming up today. What's the plan?
Yes, Shahan, I suppose it's one thing to order the vaccines. They land on an aeroplane. You've got to then distribute them around the country. Phase one is potentially a lot easier because you're dealing with healthcare workers whose place of employment are at healthcare facilities. You just got to get the vaccine there. The next part is trying to get the vaccines out to those places and to people who might not be closely, linked to a healthcare facility, and sometimes people incapable of actually getting there. There's also the question of security. The police, we understand, or we're told today, are playing a significant role in the command council and how they're going to be moving these around the country while they are safe. But then there's the other aspect of ensuring that they're kept at the correct temperature. There is a tender that is presently underway. We understand it's going to be closing in the next week or so for the movement of and storage of these vaccines that's going to be coming over the next few months. But it was Dr. Anbin Pillay that took over the presentation when it came to addressing this particular issue of logistics, Shahan. Take a listen.
When we go to phase two, which is the second risk group as such, we again will be using very similar models for the delivery of vaccine. Our healthcare facilities, both our clinics and hospitals, will remain available for vaccinations. In addition to that, we would have vaccination centers. These would be in our private pharmacies, GPs, as well as NGOs. They also may be, in addition to that, mass vaccination centers that would be included here. Then we have outreach vaccination programs. This is a service that will be provided by teams that will be traveling across facilities. And then finally, we would also, very importantly, be looking at work-based vaccination programs where essential workers such as those in the public sector, in the mining industry, etc., can potentially be vaccinated in their occupational health clinics. Many of them have such services, so it would be quite easy for them to be vaccinated within the workplace itself.